As well, ready to get going. Hey, good evening, everybody. My name is Dr. Nathan Thompson with Exemplify Health Center, an affiliate of the Wellness Way. Happy Monday evening, guys. Hope you guys had a great Easter weekend. Tonight, I want to go over with you the question that people ask is high blood pressure always bad? Okay, and this is actually a question that I talk to people in the inflammation talk because when you talk about inflammation, a lot of people really don't have much of an understanding. They've heard the word inflammation, but they really just don't know or maybe understand like what is involved with an inflammatory response, how it involves the immune system. Um, but we're taught in our country, we're taught here in the United States, we are taught that acute inflammation is supposed to be suppressed, and then the consequences of chronic inflammation or the effects of chronic inflammation should just be covered up or actually just completely hushed or completely removed. And you'll see that when you see the difference between acute and chronic inflammation, guys. And so is blood pressure inflammatory? Absolutely. It's inflammatory response, stress response. And I'm going to show you that in just a second. If you guys are watching right now, whether it's on Facebook or whether it's on YouTube, whether it's on Instagram, please make sure that you say hello. Also, let me know where you're watching from as well. So we're going to ask the question. We're going to dive into blood pressure. I'm going to give you actually a clinical case of someone that we were recently seeing who for the first time in, I think, about 7 or 8 years, completely off of blood pressure medication after being on it for a very, very long period of time. I'll actually show you her lab results and I'll kind of give you an idea of what they mean. But guys, there is no protocol. That's one of the biggest things that I'm going to tell you is there's no protocol on how to lower blood pressure. And if anybody's giving you a protocol, do one thing, please run away from them. All right. So if you guys are joining us right now, make sure that if you don't, please make sure that you follow us. You can follow us on YouTube at Dr. Nathan Thompson. You can follow on Rumble for the long format versions of what we do. And we put out a lot of short format videos, a minute and a half to 3 minutes on Instagram and also on TikTok. TikTok is the Wild West of social media. But we do it because it must be done. Make sure you guys follow us. So we're always trying to put out great content for you guys. Trying to answer your questions as much as possible and also helping you guys find the help that you need. So if you don't already, please subscribe to our YouTube channel, Rumble as well, and then make sure that you follow us on Instagram. And then also, if you like, follow us on TikTok before it gets taken down. Who knows how long TikTok will actually last. And while other people are joining us as well, make sure, guys, if you're watching from the Chicagoland area, our next inflammation talk is going to be Thursday, April 27th. At 6:00 p.m. I know that we have already had people registering for it. Guys, the stories that we hear from people who come, and this is what's interesting, guys, is I probably get criticized 4 or 5 times every single day. And usually it's from people who don't want to see a different perspective. And the number one thing I say is they never, ever attack the argument. What they say is they just say, stay in your lane and you're only supposed to do this. We're going to categorize you as this, and you have to stay in this specific lane. And I'm going to be honest with you. The reason why, and I say, well, define what the lane is, because the only reason why I have people who come to me are actually because they haven't gotten help. And so it's like, but if we help people, then what on earth are we supposed to do? And so that's why, guys, no one has a monopoly on health. Let me say that again. No one has a monopoly on health. I will tell you this, medical doctors are trying to create a monopoly on health, and they tried that in the 1930s, 40s, 50s, 60s. They actually lost a lawsuit because they specifically tried to look at anyone who wasn't part of the medical system and tried to suppress them and try to destroy them. And they lost a lawsuit back in the 1980s. And they had to admit that that's what their intent actually was. And so, guys, the principles of health, the principles of healing are the same because they're like laws of gravity. And so the only thing that we do is we say, hey, let me help you look at this from a different perspective. And that's the wonderful thing about what we do is say, what if we look at it from this perspective? Can that help solve the problems that no one else has been able to solve at this point? And so that's why, guys, I really don't care what you call it. I only care about clinical results. And so that inflammation talk, we have so many people who want to register. A lot of people from different parts of the country want to do that, but this is an in-person event, mainly because 98% of our patients are actually in person. I actually prefer it that way. But if you are from the Chicagoland area, get registered for the Inflammation Talk Thursday, April 27th, 6 o'clock p.m. That's an in-person event. Just all you have to do is go to the top of the page and pinned on our Facebook page. You can also go to our Linktree profile on Instagram, and you will see upcoming events, and you'll see the Inflammation Talk, and then you can register via Eventbrite. Okay. So I got a question for you guys as we get into it. It is this. Okay. So let me ask you guys a question. I asked this actually at the Inflammation Talk because I ask a couple of questions, and it just, when we ask questions, it helps you to start to see things from a different perspective. Because one of the first questions I say is if you fell down and you sprained your ankle, is the response that happens after an ankle sprain, is that good or bad? And everybody says, oh, it's terrible. Well, I say, well, why is it terrible? Because you're ultimately going to think that the body is stupid, or that the body is intelligent, and that the body is smart. The reason why we solve problems is because we look at the body not as stupid, we look at it as smart, and there's a reason behind everything. And that's what it's going to come down to. Either you only believe that the body messes up and that it makes mistakes. It's just a machine, it's just a bunch of parts, and it wears out, and it just starts malfunctioning, and we have to manipulate it. Or you're going to say, well, maybe the body knows what it's doing, and that every response is exactly what's supposed to happen inside the body. Doesn't mean that you never ever need fire department approach, because there are times when the amount of damage is happening too quickly, that the body can actually overcome and heal. Like, for example, you get in a car accident or something like that. So that's why we do need fire department type care. The only problem is that no one who undergoes fire department care ever gets carpenter type care, in which they're rebuilt and restored afterwards. So everybody thinks that what happens after sprained ankle is bad, and that you have to suppress it. And then I said, well, let me ask you a question. Is high blood pressure good or bad? And immediately everybody says, well, it's bad. High blood pressure is horrible. And I say, well, that actually depends. I'm going to give you a scenario in which high blood pressure is actually really, really good. Okay. So what it comes down to, guys, is it comes down to this. Is your body making a mistake, or is it adapting to help you live longer? So even if you take the whole idea behind high blood pressure, is the body mistakenly raising your blood pressure, or is it trying to adapt because adaptation is needed? And the body says, I need to raise your blood pressure right now. However, if you don't do something to start to lower it, there's going to be a consequence later on down the road. So why your body increases blood pressure is because it's actually needed. And if it's raising it, it needs it. But again, without getting to the reason why, and you keep your blood pressure elevated, then obviously there's going to be a long-term consequence with it. But if you think of it from this perspective, your body's first priority is for you to survive. And it will do whatever it takes to get you to survive right now. Yes, that is even increasing your blood pressure. And so it will rob Peter in order to pay Paul. And that's why we always say, why is this happening? Why is someone's blood pressure actually elevating? And let me give you a perfect example. Because when I ask people, is high blood pressure good or bad? And I'm going to say 95% of people will immediately say, it's terrible. You don't want elevated blood pressure. So then I say this, okay, well, let me give you this scenario. Let's say you walk out of my office and you pull a hard right. And if you go down a couple of doors, you're going to go to Mike and Denise's restaurant. But let's say sitting outside the restaurant is a giant grizzly bear that weighs 900 pounds and is 11 feet tall. And that grizzly bear is very hungry, and that grizzly bear is looking right at you, and you are the grizzly bear's next meal. So if that happens and you're faced with that situation, guess what's going to happen to your blood pressure? It's going to elevate. Now, is that a bad thing? Not at all. Because immediately what happens is you are going into what's known as fight the bear, or flight, run away from the bear. So what's going to happen? Blood pressure is going to elevate. Your heart's going to start beating harder. in order to be able to pump nutrients and oxygen, especially to your extremities, in order to give you the oxygenation and nutrients that you need to run faster, to jump higher, and to run a whole lot longer than the bear. Your pupils are actually going to dilate. Your breathing is going to increase. Your digestive system is going to absolutely shut down because it doesn't want to be digesting everything. Blood's going to get shunted to your extremities. And blood pressure, guys, is going to go way up because of the increased demand that you are going to face here in just a couple of seconds. So at that point, blood pressure is really good. And you wouldn't tell the bear, hey, you know what? I don't want to do anything to increase my blood pressure because my doctor told me that it was really bad for me. So what I'm going to do instead is just going to walk away. And maybe if you, instead of running after me, just walk after me. And then we'll both keep our blood pressure low. And so when you look at this, this would be high blood pressure due to a stress response. It would be also no different than if we locked you in a room and set the room on fire, and then we saw the response that would take place from you being locked in a room that was on fire. And if we took you immediately out of the room thinking that death was imminent, and then took your blood pressure, we would see that your blood pressure was elevated. We would start to see all of these chemical changes take place, and we would see blood pressure elevated. And if you think about it at that time, if you had no context behind why your blood pressure was elevated, then one of the things that you would do is the doctor would say, well, look at your blood pressure, it's elevated. Maybe we just need to start to lower it. But again, when it comes to having elevated context, this is why this is so important, that you need the context behind it. And so that's why we need a lot more doctors versus clinicians, because clinicians follow a protocol and doctors look at everything as a whole. And that's what we're trying to do within the Wellness Way approach. So in this case, if a bear is chasing you, then I actually would want elevated blood pressure. Here's another scenario on why you would have elevated blood pressure. Let's say that you have a massive amount of inflammation inside the body. And in fact, we actually just measured a woman today, went over her test read today, and her C-reactive protein was at 13. And I said, your C-reactive protein is 13. Anything above 3, high risk for cardiovascular disease, for heart attack, for stroke, things like that. And she said, oh, well, that's actually down because a couple of years ago I had it and it was at 38. And I said, well, there's something that's very inflammatory. You're probably trying to fight off some kind of infection that's going on long-term, especially. But if people who are really, really inflamed, well, they tend to get a lot of cholesterol deposition within their arteries. That's why heart attacks and strokes really inflammatory issues, guys. And I want you to think of this. If you had a normal artery, okay, a normal artery, and this is fluid dynamics, and think of it like a garden hose. If the garden hose is open like this, well, then you don't need as much pressure as if the garden hose was more like this. So as arteries or hoses, as they constrict, then obviously with fluid dynamics, you need more pressure in order to be able to push it through a narrowed lumen. So people do have some issues with narrowed arteries. A couple of things can be happening. Some arteries are swollen and they get narrowed. It's an inflammatory response. If you are actually getting soft plaquing that's taking place, that's going to narrow the lumen of the arteries, you're going to need more pressure to actually be able to get it to go through in order for you to be able to supply the downstream organs and cells and tissues with nutrients and with oxygen. This is why if you look at blood pressure medication, one of the most common symptoms or side effects of being on high blood pressure medication is in fact fatigue. If you guys know that, it's fatigue. And just think about it. If you have that going on and you try to lower your blood pressure when the blood pressure needs to be higher, well, you're not going to be supplying the target tissues with nutrients, oxygen, the way that it in fact is supposed to. It's not to say that you should never ever go on a blood pressure medication, but we should be figuring out why that inflammatory process is actually happening. So that's why it can be a stress response. It can be a smaller lumen due to an inflammatory response into plaquing and things like that. And there's also some couple other reasons. And this is why, guys, when you look at your body does a couple of things in order to try to raise blood pressure when it's needed. One of them is actually a stress response, like adrenaline, that's coming from the adrenal glands as a response to fight or flight due to a stress response. And remember this, guys, when you're talking about a stress response, it doesn't have to be a real bear. It can be a perceived bear, which is why mental stress, they say, raises blood pressure. So anything that puts the body into fight or flight has the ability to be able to raise your blood pressure. So it can happen through a stress response. It can also happen through a response in which the body is actually trying to raise blood pressure by trying to hang on to calcium or onto sodium and then also excrete potassium. So I went over this last week. And if you didn't catch last week, when we talked about, hey, going on a low salt diet, here's why it lowers blood pressure. But as a consequence, you'll also see a lot more adrenal hormones, a lot more adrenaline, a lot more aldosterone. You'll actually see that it can stress the adrenal glands as a result, which is why you see LDL go up on average. And I did a short reel about that as well. But if you look at how the body long-term tries to regulate or tries to increase blood pressure, and it's called the renin angiotensin aldosterone system, the RAAS system. And that's why, when you look at blood pressure regulation, it's why it involves the kidneys, it involves the liver, it involves the adrenal glands, and it also involves the lungs. This is why you have to look at things from a Swiss watch principle, that all of these organs are actually working together for something that seems so simple as just blood pressure. So if you look at how the body raises blood pressure, your kidneys, which means you also have to have healthy kidneys, they actually make an enzyme known as renin. The liver makes basically a pre-hormone known as angiotensinogen. And then renin actually cleaves that off to form angiotensin 1. That actually gets converted in the lungs, known as angiotensin converting enzyme. Now you're making it's kind of making sense because of what kind of blood pressure medication maybe your doctor has put you on, converts it into angiotensin 2. That has an effect on the adrenal glands, and the body increases aldosterone, and then aldosterone works on the kidneys in order for you to be able to decrease the excretion of sodium, hanging on to sodium, and increasing the excretion of potassium. And when you hang on to sodium, then your blood pressure actually starts to go up. So there's a reason why that happens. But then when you look at how some of these medications then work, well, a lot of these medications are working with this system, okay, or they're trying to suppress this system. That's why if you look at your blood pressure, look at how it's affecting the body, because most of them are considered ACE inhibitors. And they're actually working on blocking angiotensin converting enzyme in the lungs. Guys, this is why one of the long-term side effects of being on this can actually cause a chronic cough, because it's working on the lungs. You may have been on a beta blocker, and that's basically blocking an adrenaline response from the interior part of the adrenal glands. Or you also may be on diuretics. In fact, a lot of people are on an ACE inhibitor and also a diuretic, which is starting to really, really mess up, your sodium and potassium balance. This is actually why, guys, when you go on certain blood pressure medication, while it actually will cause excretion of sodium and spare potassium, this can be why your doctor says, I don't want you eating any potassium, because it can cause an increase in potassium in the blood. And this makes it really hard, guys, because your body needs sodium and it also needs potassium. And in fact, it needs more potassium than it does sodium. And so many people are so potassium deficient. But just remember this, you cannot measure potassium accurately by just doing a blood test. Who says so? National Institutes of Health says so. Mayo Clinic also says so, because most of your potassium is within the cell and it's not within the blood. So it doesn't make a lot of sense to me. I'm saying, you're going on a blood pressure medication to lower your blood pressure, but now you're going to become massively potassium deficient because the doctor told you, start restricting your potassium, don't get any additional sources. And I always wonder, I'm like, did they really tell you not to have an avocado? Did they really tell you not to have any kind of ground-based veggies that have potassium in it? Because now if you don't do that, now you're going to be missing out on all kinds of nutrients as well. And now you're going to become nutrient deficient in something, but I imagine that they probably have a drug for that as well. So that's how these medications, those most common ones, are working to try to lower blood pressure. They're either working at the kidneys, they're either working at the adrenal glands, or they're working at the level of the lungs. So I want you to think of this. When you talk about blood pressure meds, what are they really, really doing? Well, they're really only doing this, is that number one, they're really manipulating sodium and potassium. They're trying to manipulate your sodium and potassium levels. Number two, they're just trying to manipulate a stress response. And this is so true, especially with people who have chronic issues with mental stress. This is also, with issues of people who aren't getting enough sleep. This is also true with people who are very, very chronically inflamed and always having a stress response. So they're manipulating either sodium, potassium, a stress response, all as well. There's also things that then manipulate the absorption of calcium as well within the heart, within the artery system, calcium channel blockers. And then there's also some that which is not as common, that try to relax the arteries from here and try to relax the arteries. That's actually how these medications are actually working. So I want you to think about it. If you look at these medications and you're saying, okay, they're working on sodium, potassium, the stress response, calcium, or they're trying to relax the arteries, well, then what causes then high blood pressure? Okay. So just think about it. If we just looked at everything the opposite, maybe high blood pressure can be caused by a couple of things. Maybe it can be caused by you not getting enough potassium. It is actually well known, guys. You increase your potassium, you can actually lower your blood pressure, which doesn't make like potassium some kind of miracle cure for high blood pressure. It just means that if you took extra potassium and it lowered, well, then you only brought your sodium and potassium back into the balance in which it actually needs. So what also can, cause high blood pressure? A stress response, aka a bear chasing you. What about inflamed arteries? Here's another cool thing. What about nitric oxide? So if you look at nitric oxide actually helps to open up the arteries. There are people who have problems with a chemical process that's known as methylation. And if you're a poor methylator, then you typically will have elevations in blood pressure. If you're also a poor methylator, you will also have problems with detoxification. If you're a poor methylator, you will also have problems with some anxiety and depression. If you're a poor methylator, you're going to have a lot of issues. You will also be very inflamed, which is why I've talked about a lot. If you look at like people, for example, with fibromyalgia and things like that, typically, guys, those people are very poor methylators. Where does it happen? Methylation happens primarily 95% of it in the liver, but it truly does happen all over the body. And if you look at the addition of a carbon and 3 hydrogens, this is involved in so many processes. The metabolism of what's known as homocysteine. This is in the production of things like serotonin, the production of some amino acids into creatine, which you may have poor muscle function as a result. But nitric oxide is also needed at the endothelium in order to open up the arteries. This is what's so incredible, guys, is when we start looking at this at a deeper level. And then it also can be due to having poor kidney function as well. Don't forget about the kidneys. And the number one cause of having poor kidney function is anything that damages the kidneys. And this is going to be type 2 diabetes, especially. So, again, guys, you have elevations of blood sugar. It causes ages, advanced glycation end stages. And this the process of glycation damages the soft tissues. And this is why when people have blood sugar that's out of control, this is why they tend to have so many issues with joints and joints replacements, why they have swollen arteries, high blood pressure. But remember, your kidneys are also soft tissue. And so it can damage and scar the tissues and decrease kidney function as well. And guys, you don't have to look very far. Just go down the road or go ahead and go on Google Maps and look at kidney dialysis centers, and you're going to know that this is one of the most up and coming centers because so many people are suffering with problems with their kidneys. So low potassium, stress response, inflamed arteries, poor methylation leading to deficiency of nitric oxide, and even poor kidney function. So it may be one, it may be two, it may be all five. And guys, this is why when they look at blood pressure medication, guys, the average decrease of a blood pressure medication, usually on two, is anywhere from 10 to 15 millimeters of mercury, which is not all that impressive. So, but they're trying to reduce it any way that they can because, yes, there is a very real long-term consequence of having elevated blood pressure, but you have to say, hey, let's figure out why this is happening. Please, let's figure out why this is happening. And let's work on if your blood pressure was normal 10 years ago, then why can't you get back to that? Because you're doing something that's causing the body to have to rob Peter to pay Paul. There's a long-term consequence, but obviously the body says we need this high blood pressure, even though if there's going to be some kind of long-term consequence. So I want to show you some lab work that we did. And I was doing a phone consult with this woman. This was, I think, last week. And we've been working with her for about 3 months or so. And we're going to be getting new blood work on her and probably have it within the next 3 to 4 weeks. But when she came in, here's someone who's not old. She's in her mid to late 40s, but she has been on blood pressure medication for a very, very long time. And when she was put on a blood pressure medication, she had high blood pressure of 180 over 130. So you can imagine that. They actually put her on an ACE inhibitor and that lowered it down, but then they try to lower it even more and put her on a diuretic, and that didn't even touch it, as well. So she still had high blood pressure. It still wasn't higher than a high blood pressure. It wasn't as high. It was just lower high blood pressure. But she also had some other things, guys, because remember, your body is going to leave clues. She had an inability to be able to lose weight. And then she had also had some hormone issues when it comes to hysterectomy. Here's what's interesting when you start looking at this from a different perspective. So number one, her hemoglobin, A1C, and also fasting blood sugars were elevated. So she had pre-diabetes that's going on. So high blood sugars. Remember, look at this and how it affects the kidneys and how it affects glycation of the soft tissues, including the arteries. And then you can also see she had very, very high ferritin. Get your labs out, guys, and see if they've ever checked your ferritin levels, which is basically stored iron. And you can see, guys, that clear across the board, if someone has elevated ferritin, they have a fatty liver. So now you can see, wow, she had some issues when it comes to having a fatty liver. And guys, if you have a fatty liver, you're going to have problems losing weight and you're going to have problems with your hormones because your body has to convert these hormones and remove them from the liver into the gallbladder and then into the gastrointestinal system as well. You can also see that she had some elevations of some white blood cells. Okay. So when you have your white blood cell count up at 8.1, even though it's considered normal, I still think that that's elevated. And so there's some kind of inflammatory response that's taking place. Also very low vitamin D as well. And then if you look, you even see her platelets that are elevated. Remember, platelets elevate in response to inflammation. And guys, if you have elevated platelets, remember, what does that do? It makes your blood sticky, okay, which puts you at a higher risk for having, clots. And we would call that heart attack, and we would call that stroke due to thrombosis is what it's called. So when you look at this, I want you to think of it. So all of the blood pressure medication lowered the blood pressure a little bit, but you still see from looking at her labs, she's still sick. So all the blood pressure medication did is it's just like cutting out the tongue of a baby who's crying. Well, you may not hear any crying anymore, but you sure as heck didn't get to the reason why the baby is crying in the first place. So when you look at this, your body is leaving clues to say, gosh, I am really inflamed, type 2 diabetic, and I have a fatty liver. So what did we do? Well, we started working on not hurting her, not continuing with the inflammation, and allow the body to be able to calm down and to be able to heal. So when I just got off the phone with her, this was about three and a half months. And by that point, in fact, we didn't even ask her, hey, how much weight, have you lost? This is kind of a side thing because a lot of people think, well, if I lose weight, all my problems actually go away. But it's actually how we have people lose weight. It's inflammation first and then fatty acid metabolism second. So when I said, hey, how are things going? She says, well, I've lost 35 pounds. I've been taking my blood pressure, 3 to 4 times a week. I'm not on any blood pressure meds anymore. And my blood pressure now is consistently at 130 over 80. Is it still a little bit high? Yeah, I think that it would. We still have some work to do. But this is not under the influence of any kind of blood pressure medication actually manipulating her. Now, do I have the authority to take her off of a blood pressure medication? No, I don't. And that's why, guys, you really do need to be working with a doctor who should say, I am overjoyed that you're able to go off of this blood pressure medication because it means you're healing. It means you're getting better. And I can't wait for you to be able to go off of these medications. But the reality is, guys, is how many doctors are giving you a plan to be able to get healthy enough and to start removing causes so that you don't need to be on blood pressure medications. In fact, most of them will say it's impossible to lower it. And what I say is, if they're telling you it's impossible, then find a doctor who is going to say that it's not impossible, because this right here is not an anomaly. This is actually a normal consequence of finding, eliminating, and then allowing the body, which already knows how to heal, knows how to do it. And I want you to think of it. When she was 25, she didn't have high blood pressure. Why did she get it at, in her late 30s? Because if it was genetic, she'd be born with high blood pressure. So why did it happen at that point? And why is it actually lower now? And this is why genetics are basically, when a doctor blames genetics, they're really just saying, I don't really know. So here's my answer. And I don't believe that you are genetically programmed to die early. If it is a truly genetic issue, it will be expressed from birth, which is why I always say, then why did your genes express itself at 25? Why did they express itself in the form of disease at 35 or 55 or 65 years of age? Why did it happen then versus, why wasn't it expressed at birth? Because true genetic issues are expressed from birth. So here she is, in which she's lost 35 pounds off of blood pressure medication, and her blood pressure is creeping down within the normal as well. Okay. So what is the protocol? Because that's what people will actually will ask. What on earth is the protocol? Well, there is no protocol because it depends on your testing. But things you got to look out for is, what your salt and potassium balance is. You need to look at inflammatory markers. You have to look at methylation and the liver. And you also have to be looking at your blood sugar, and how it affects the kidneys as well. So what can I do, Dr. Nate, to help? Well, this is why I never answer a question when people will say, what can I take? Because some of the sickest people that come in are on 35 different supplements. And I have to look at them and I say, hey, how's that working for you? And they're like, it's not. And I'm like, save your money. Let's start from ground zero and let's actually do this in the right order, because inflammation is the first thing that you need to start to address. But I put these up here only because, hey, what can help? Well, anything that helps with the cause will help. All right. But what we want to do instead is we want to do, some kind of double blind research on nettle and its effect on blood pressure. And they say, well, in some people it worked really well. And in some people, we didn't see any change. So I guess it just doesn't work as well. And that's why it's really, really hard to take a food or to take a diet or to take a supplement and just look at one condition and think that that one supplement is going to correct that one condition, because so many things, guys, are so multifactorial. There's more than one reason that's going on. So can Albesia do it? Technically, yes. Can nettle leaf do it because it actually blocks your ACE2 receptors? Actually, it can. Can it actually help with blocking the receptor sites for COV, et cetera, infection? Actually, it can as well. What about turmeric? Well, actually it can, but I always say, why are you so inflamed and need to be taking turmeric all the time? How about desiccated liver? Technically it can, because desiccated liver is actually high in vitamin B12. and also is providing a lot of methyl donors, which can help with methylation if that is your issue. How about Neo 40? If you guys never heard of Neo 40, Neo 40 actually helps with nitric oxide production. So it actually helps to open the arteries. We've given people say, hey, we want you only to take this for about 3 months. And then as blood pressure we see start to go down, we'll start weaning you off of these things. But guys, Neo 40 is just actually contains a lot of beets, concentrated beets, and vitamin B12, methylated B12, methyl B12. California poppy, can that do it? Yeah, because California poppy is a sedative, and it works on the brain, and it helps to block a stress response. So if you have high blood pressure due to chronic stress, then yeah, consequently, California poppy can help as well. So could kava. So could CBD oil, because they work very similar. And how about, guys, even a chiropractic adjustment? What on earth are you talking about, Dr. Nate? That's complete quackery. Well, they studied this over 10 years ago at the University of Chicago Hypertension Center. George Bacris, MD, was the head of that. Actually had a chiropractor come in and he looked at people with high blood pressure. Chiropractor adjusted the top bone in the neck. Average lowering of blood pressure was about 12 points off the top number. And he said, oh my gosh, we've seen a lowering of blood pressure just by doing that. And it actually has the same effect of the top 2 blood pressure medications on the market today. Well, why does that happen? Because if you look at the vagus nerve and its ability with normal function, how it takes you out of fight or flight and puts you into rest and digest, which is why for some people, correcting the spine and the nerve system can actually help your blood pressure. And we've seen that happen all the time as well. That's why you have to address physical, mental, chemical, guys. It's not always just a chemical issue. And it's no different than if you have a pebble in your shoe and you think, well, what kind of natural supplement or anti-pebble medication do I need to take so I don't feel this pebble in the shoe? And I say, no. This is a physical problem. You need to reach down, pull the pebble out of your shoe, put your shoe back on, and your problem is solved. And that's why when you have mental issues, mental stress issues, you got to have a mental stress issue solution. Chemical issues require a chemical solution, and physical issues require a physical solution. And all of these 3 things actually tie together. So, it's you have to start addressing the biggest reasons why. And that's why within the Wellness Way, we are experts at looking at all 3 and looking at your whole body as a whole. And the biggest piece of advice, guys, that I would tell you is this, because for a lot of you, you've gone from, I don't want to be on medication, so what do I need to take that's natural? We call that the Dr. Oz effect. And I say, go even a step more than that and say, tell me what's causing this by looking deeper. And that's why I will always say this, guys, stop trying to replace a bad lifestyle with drugs, or trying to hush the symptoms with drugs that's caused by a bad lifestyle, and only replacing it with the same bad lifestyle, but instead you're taking supplements, because that may lower your blood pressure. But the problem is, you go off of the supplements, you go off the drugs, the blood pressure actually starts to go back up. And that's why, guys, you always have to get to the cause. And this is one of the things that we talk about at the Inflammation Talk. Our next one is Thursday, April 27th at 6 o'clock p.m., probably lasting till about 7:15 or 7:30. But when people hear this, the light bulb actually starts to turn on. They say, wow, you know what? I thought you were crazy, but now that I see it from a different perspective, wow, that makes a lot of sense. And remember, all we do is we solve the problems that other healthcare providers can't, because we look at it from a different perspective. Remember this, you're either going to believe the body is stupid and messing up, or that the body is smart, that the body is brilliant, and really what it's trying to do is to adapt. And so what we need to try to figure out is why is the body adapting this way? And what can we start removing so that when we remove cause, the body adapts into health versus adapting into a chronic degenerative illness process. So hopefully, guys, I hope that makes a lot of sense to you. Even just talking about, just blood pressure, because I know a lot of people have issues with blood pressure. So again, my question to you is this: is blood pressure always bad? The answer is it's not always bad. It's only bad if you never ever get to the cause and you allow the body to continue to adapt to survive, because there's always going to be a long-term consequence. So let me know, guys, what you think. And if you enjoyed this video, please, as always, make sure that you share this video on your timeline. Tag someone who you know that could benefit from hearing what we went over tonight. And again, make sure that you follow us on Rumble, follow us on YouTube to catch the replay. That's probably the easiest way that you can share these videos with other people. And if you are coming from the Chicagoland area, get registered for the Inflammation Talk, because I can't wait to help you to see what's going on with your health and be able to look at it from a different perspective. So guys, I hope you have an awesome rest of your week. We'll be jumping on. Make sure you follow our page, because we'll be also putting out a lot of awesome content for the rest of the week. I hope you guys be well, be blessed, and always remember who you are.